Hello, welcome to my video series on patient education after knee replacement. I'm Dr. David Graybill. I've written a recent book, A Proactive Approach to Knee Replacement, which is available on e-format early now. This video is being made in early November, adjacent to Halloween. The book is available on Kindle, Apple, Barnes & Noble, and the publisher is BookBaby. I encourage you to pair these talks with the book. This is the last of my planned video series. I've got a number of videos on preoperative issues about knee replacement, on outcomes around knee replacement, 3 talks about immediate post-op knee replacement, covering pain, early range of motion, swelling management, and now my current topic will be kneeling after knee replacement, which was a common question that I got during my career replacing many patients, thousands of patients' knees. I've had both my knees replaced. I do have a little difficulty about kneeling, so I thought this would be a good topic. It's mentioned in the book. It's not by any means a topic I covered in the book, aside from mentioning it. One of the reasons I'm posting this video is I attended the recent American Association of Hip and Knee Surgeons, and a paper was presented. I believe it'll be published sometime within the next year or so, covering statistics on painful kneeling after knee replacement. So I thought that would be an interesting topic for many people. I have had a number of patients that required kneeling after knee replacement. It is somewhat of a struggle, so we want to be honest about that to patients. So let's move onwards to the bulk of the talk. So, common question, sometimes a critical factor for patients, if say you lay carpet or lay bricks or that type of activity, your employment requires kneeling. Will I be able to kneel after knee replacement? So this was a very common question. The short answer is yes. There is absolutely no harm with kneeling after knee replacement. A knee replacement, whether the patella is resurfaced or not, will not be damaged by kneeling. Obviously, early on, the skin's going to be very sensitive. It's very uncomfortable to kneel in the first few weeks after surgery. We want to get a well-healed wound, get our swelling out of the way. So this is not an early postoperative question. This is a late postoperative question. After I'm fully recovered, will I be able to kneel? So that's really the focus of this topic. So moving onwards, there's no harm. Everyone can kneel after knee replacement. The question is, how uncomfortable will it be after knee replacement? So this is kind of a difficult question to answer because there's some randomness in it. Anybody that's had any form of knee surgery has difficulty kneeling for a good period of time. So some of that is incisional related, some of that is inflammation related, and some of that is kind of a long-term thing. Knee replacement's a significant surgery. There's an incision generally over the front of the knee, and that obviously cuts little skin nerves in that area. So some of the discomfort is really from the incision. So we've seen people with similar incisions to total knee replacement also have trouble kneeling after knee surgery, and that is sometimes a long-term issue. So, for example, myself, I've had both my knees replaced. The first one was replaced about 5 years ago currently, and the second one about 3 years ago. I can kneel. If I kneel on a hard surface, I can't kneel for very long. My knee arthritis specifically was patellofemoral, which means kneecap, so I couldn't kneel before surgery either. So I'm not significantly different. I would say, if anything, maybe I'm a little bit better in my ability to kneel. there is variability here. So the caveat, which I was mentioning here, is many patients are uncomfortable. So 6 months to a year after knee replacement, when we have basically full recovery, except for maybe a little bit of endurance and stair climbing issues, many patients find it uncomfortable to kneel. This is usually related to the surface. So obviously kneeling on concrete, ceramic, very hard surface is more difficult for everybody, whether you've had knee replacement or not, compared to like a padded carpet, rug, knee pads, or a pillow. So typically, the softer the surface, obviously the easier this is. So that's one way to moderate discomfort after knee replacement. The patients that I had that required kneeling to return to work took longer than most patients to return to work, but they were able to get back to kneeling in their job. So they usually required like a mobile pillow or cushion or a knee pad, although I think 1 or 2 patients were able to get back with no padding at some point down the road. So what's the data on this? Again, there was a recent article presented at the American Association of Hip and Knee Surgery annual meeting 2025. And that this, I'm not going to give exact statistics. That paper will be published again, I think later this year. But it did suggest that the number of patients that report pain with kneeling was a little higher after knee replacement than the rate before knee replacement. So that is something I would just caution you if you don't have pain with kneeling after knee replacement. You might have it, or sensitivity is a better way to put it, to kneeling after knee replacement. So that could be a source of dissatisfaction. It's very important, I think, that patients are aware that that occurs. I believe the statistics were very favorable in that more than 80% of people were able to kneel after knee replacement without significant problems. But again, knee replacement did increase the number of patients who had discomfort. Then there's some data in that paper about kneecap resurfacing and not, and dissatisfaction that really don't apply, I think, to the general public here. My point is that kneeling after knee replacement is something you can safely do, but you may have some discomfort with. Everyone will have discomfort early, but late it may create some problems, but it's a manageable problem for myself. Like if I use a yoga mat, I can do yoga on my knees pretty comfortably, and I think I fall into the middle of the category of patients with discomfort after knee replacement on kneeling, and it doesn't really affect my satisfaction. Now, I was still working after knee replacement, but I didn't require kneeling. I found I could easily modify my position to get around it. Getting up and down from the floor is something that's a little more difficult as we age anyway. And kneeling, I viewed that a little bit in that category. So, onwards, my thoughts. Be aware of this information. If you're having knee replacement, you want to understand this. It is, I think, manageable for 99% of the population without any significant problem. Again, the caveat would be if you are someone who works and requires kneeling, be aware that you may need a pad or a pillow. Again, I chose this type of pillow just because the holiday, and I was able to obtain a picture that was currently on the internet without any licensing problems. So this concludes my current series of patient education videos after knee replacement. Again, it pairs with my book. I encourage you to pursue the book. The more information you have before knee surgery, I think the better. The amount of information out there is very difficult to capture in any office visit, no matter how long you spend with your surgeon, PA, or nurse. There will be information that you haven't captured, which will be beneficial to your recovery. So whether you use my book or something else, I strongly encourage you to become as well informed as possible. Additionally, I'll mention there are exercise videos in the same website, which I encourage you to make use of. A number of them are for preoperative and postoperative use. The majority of them are also useful postoperatively. So I hope this has been helpful, and I encourage you to be well informed. And thanks for your attention. Have a wonderful day. Bye now.